Hey there, it's Dr. Jim. Thanks for stopping by again. My topic today it's a serious one. It's frontotemporal dementia, which we're hearing more about, and the risk of suicide. Okay? So recently a group of Italian researchers examined the risk of suicide among individuals diagnosed with a specific type of frontotemporal dementia called behavioral variant frontotemporal dementia, or it's abbreviated as bvFTD. They stress that while the incidence of suicide among individuals diagnosed with dementia is rather low, and it's true, for instance, individuals diagnosed with Alzheimer's have a very low rate of suicide. This type of dementia, on the other hand, carries a much higher risk for thoughts and actions related to suicide. So frontotemporal dementia is actually a group. It's not one diagnosis, it's a group of neurodegenerative disorders characterized by progressive deterioration in behavior and language due to misfolded proteins in the frontal and the temporal lobes. There are three main types of frontotemporal dementia. Behavioral variant, FTD, and that's the one we're talking about, semantic dementia, and then progressive non-fluent aphasia, which is spontaneous speech marked by hesitancy and errors. So, behavioral variant frontotemporal dementia. It is now well known that frontotemporal dementia is the second leading cause of presenile dementia, affecting people younger than 65, and that behavioral variant frontotemporal dementia is the most common type of frontotemporal dementia. Behavioral variant is characterized by pronounced behavioral disturbances, that's why it's called behavioral, including impulsivity, repetition of words or sounds, disinhibition, loss of empathy, and progressive cognitive impairment. Those are the key characteristics. Recently, it was found that there's a relationship between bvFTD and several psychiatric disorders, and that psychiatric symptoms may actually be the first signs of this type of dementia. So, some psychiatric signs, red flags, may actually be indicative of this type of frontotemporal dementia developing. And this could happen even years before any behavioral or cognitive symptoms become noticeable. So the risk of suicide, even though the risk of suicide is low in individuals with dementia in general, changes in mood, significant cognitive impairment, and awareness of the disorder may lead individuals with certain types of dementia to think about or attempt suicide. According to this Italian study, the first known case of suicide related to behavioral variant frontotemporal dementia occurred several years ago in 2012, and it was just a few months after being diagnosed. Shortly afterward, another study confirmed the risk. The goal then of the Italian study was to examine possible neuropsychological and neuropsychiatric risk factors involved in suicide and behavioral variant frontotemporal dementia. So there's a connection. That's the big takeaway, one of the big takeaways. The research team discovered their group had higher risk for both suicidal thoughts and attempts by non-fatal poisoning and jumping from windows. Those were the two ways that people tried to kill themselves. They showed higher levels of functional and cognitive impairment, as well as apathy and, of course, impulsivity. The group also exhibited hopelessness, depression, anxiety, and stress. Another risk factor was age. And I've seen this in a number of studies looking at neurocognitive disorders and suicide. So the risk factor age involved individuals who were younger and had the disease for a longer period of time. So they were diagnosed very young, or younger than 65 for sure, and they've already had the disease for years. Those with depression, anxiety, and other factors, were incredibly risky in terms of suicide. Okay? There is evidence that these findings are similar among individuals diagnosed with Huntington's disease. My takeaway, globally, suicidal behavior is a major cause of disability, and it's the 15th leading cause of death on the planet Earth. Suicide is associated with various neuropsychiatric and neurodegenerative disorders, including bvFTD, behavioral variant frontotemporal dementia. Taken these results, suicide risk should become part of the assessment of individuals diagnosed with bvFTD and related disorders, especially those who are younger and have had the disease for a longer period of time. Early identification may lead to better treatment and reduce suicidal thoughts and the actual suicidal conclusion. So that's my take on frontotemporal dementia and risk of suicide. I hope you enjoyed this review, and you'll share it with a friend or a colleague. My name's Dr. Jim. I'll be back for lots of really interesting topics that we can all critically think about together.